Good afternoon. My name is Dr. Joydeep Chakrabarti and I lead a team of dedicated individuals at the Amri Institute of Hematology and Bone Marrow Transplant. And given the expertise that we have in manpower and also the equipments that we need for a good medical practice lab, we can now proudly say that we are able to perform all kinds of transplant in this institute. Also, we deal with lots of hemato-oncological cases, and we definitely have good success rate in that. A bone marrow transplant is also called a hematopoietic stem cell transplant. As you know, the bone marrow is the mother bed of all blood cells, and when this tissue is not performing well and also maybe producing abnormal cells as in cancer cells, what we do is that we replace this tissue with a healthy one. And where do we get a new tissue from? It is either from the patient himself or herself when he is in remission, the so-called autologous bone marrow transplant, or we take it from another donor, and that is called an allogenic bone marrow transplant. In an allogenic bone marrow transplant, the best donor is a sibling, and there is only a 25% chance that the sibling will be a match to the patient. And if the patient is not a match to the sibling, what we can do nowadays is what we call a haploidentical transplant, or do a transplant with a half match. So here we take a half match donor, for example our parents or children, and do a transplant. This is a new and complicated procedure and is called a haploidentical transplant, and we are able to perform all kinds of transplants, including this, in our institute. Now let us share the experience of a couple of our patients who have undergone bone marrow transplant recently. This is a very young friend of ours and she is obviously doing much better than what she was before.
मेरा प्रॉब्लम में से स्टार्ट हुआ था, ग्लैंड निकलने लगा था साइड में। फिर डॉक्टर्स के पास गई, चेकअप हुआ तो पता चला ब्लड कैंसर है। केमोथेरेपी हुआ लेकिन ठीक नहीं हो पा रहे थे हम। फिर उसके बाद बोन मैरो ट्रांसप्लांट हुआ। फिर मेरी बहन का सेल 100% मैच किया मेरे सेल से और डॉक्टर्स बोले कि ट्रांसप्लांट करना पड़ेगा, तो ट्रांसप्लांट हुआ। उसके बाद धीरे धीरे करके हम ठीक होने लगे और अभी भी हम ठीक हैं, पहले से बेहतर हैं।